Back in the spring of 1845, a young woman walked into Vienna General Hospital full of hope. Like countless mothers before her, she was there for one of the happiest moments of her life, the birth of her child. Her labor went smoothly. She delivered a healthy baby boy. Everything seemed perfect. Then something terrifying happened. Just days after giving birth, she developed a raging fever. Her body began to fail, and despite the doctors doing everything they knew how to do, she died. The official cause of death was listed as puerperal fever, also known as childbed fever, a mysterious illness that struck women shortly after childbirth. It came on fast, and once it did, there was often nothing anyone could do. At the time, childbed fever was one of the greatest medical mysteries in Europe. In some hospitals, nearly 1 out of every 3 mothers who gave birth never made it home to their families. No one knew why. Some blamed bad air, others blamed it was overcrowding, stress, or even God's will. Doctors had theories, but no real answers. And nowhere was the mystery more obvious than at Vienna General Hospital. It was one of the largest maternity hospitals in the world. To handle the enormous number of patients, the maternity department was divided into 2 separate clinics. On paper, they were almost identical. The women came from the city, they were treated in the same building, they gave birth under nearly identical conditions. Yet there was one horrifying difference. If a mother was admitted to the first clinic, she was 3 to 4 times more likely to die than if she gave birth in the second clinic. Women knew it too. Many mothers would literally beg to be admitted to the second clinic. Some even preferred giving birth in the streets rather than risk being assigned to the first. Something was terribly wrong, but nobody could explain it. Then, in 1846, a young Hungarian physician arrived at the hospital. His name was Ignaz Semmelweis. Unlike many of his colleagues, Semmelweis refused to accept the mystery as unsolvable. He became obsessed with one question: why there were so many mothers dying every month. He carefully studied hospital records, compared patient after patient. He looked at weather patterns, he examined overcrowding, he considered diet, ventilation, religious customs, and even the position women gave birth in. Nothing seemed to fit. The numbers simply refused to make sense. Then tragedy struck, much closer to home. In March of 1847, one of Semmelweis's closest friends and colleagues, Jacob Kolechka, was supervising an autopsy for medical students. During the demonstration, a student accidentally nicked Kolechka's finger with a scalpel. At first, it didn't seem like a big deal, but within days, Kolechka developed a severe fever. His body became swollen, his organs began shutting down. Not that long afterward, he was dead. Semmelweis was devastated, but as he read through the autopsy report describing his friend's death, something stopped him cold. The symptoms were almost identical to the women dying from childbed fever. That realization changed everything. There was one major difference between the 2 maternity clinics. The first clinic was staffed by doctors and medical students. The second clinic, however, was run primarily by midwives. Every morning before visiting pregnant women, the doctors in the first clinic began their day in the autopsy room, dissecting the bodies of patients who had died the day before. Then, without washing their hands, they walked directly into the maternity ward. They examined women in labor and delivered babies, performed internal examinations, moved from patient to patient. Today, that sounds horrifying. But back then, nobody knew bacteria even existed. The germ theory of disease hadn't even been discovered yet. Doctors actually believed that the smell of death simply clung to their hands. They had no idea they might be carrying something far more dangerous. Semmelweis formed a bold theory. He believed that dead bodies contained what he called cadaverous particles, tiny invisible substances from corpses were somehow entering the bloodstream of healthy mothers during examinations. And those particles were killing them. He couldn't see them, he couldn't prove exactly what they were, but he had a way to test his idea. He ordered every doctor and every medical student working in the first clinic to thoroughly scrub their hands with chlorinated lime solution before touching a single patient. Not rinse, not wipe, wash them completely. Many doctors complained, some thought it was insulting. Others argued it was unnecessary, but Semmelweis insisted. Then the results came almost immediately. The death rate began to just fall. It dropped to just 2.2% the very next month. It fell even further, only 1.2% of the mothers died. The difference was astonishing. Thousands of lives could be saved with one simple habit: wash your hands. Semmelweis believed the evidence was overwhelming. Surely hospitals across Europe would adopt his discovery immediately, but nay. Instead, many rejected him. His findings challenged everything physicians believed about disease. Even worse, accepting his theory meant admitting that doctors themselves had unknowingly been responsible for killing thousands of patients. That was a difficult truth for many to face. And then there was another problem. Semmelweis could prove that hand washing worked, but he couldn't explain why it worked. He had just discovered the solution decades before science had discovered germs without a scientific explanation. Many influential physicians dismissed his conclusions. Some mocked him, others ignored him completely. The stress began to consume him. Frustrated that mothers continued dying unnecessarily, Semmelweis became increasingly outspoken and angry toward his colleagues who refused to change. His behavior grew erratic, and eventually in 1865, his own family secretly arranged for him to be committed to a psychiatric asylum. He believed he was going somewhere to recover. Instead, he was locked inside. Reports suggest he resisted. Guards beat him up severely. Within 2 weeks, the wounds became infected. He developed sepsis, the type of infection he had spent his life trying to prevent. And at the age of 47 years old, Ignaz Semmelweis was dead. Years later, scientists like Louis Pasteur and Joseph Lister would finally prove that invisible microorganisms cause disease. The germ theory of disease transformed medicine forever. Hand washing, sterilized equipment, clean operating room. This became the foundation of modern healthcare. Today, before every surgery, before every delivery, before every medical procedures, doctors wash their hands because of principles Semmelweis fought for nearly 2 centuries ago. Millions, perhaps hundreds of millions of lives have been saved because of an idea the world initially refused to believe. History eventually proved him right. Sadly, Ignaz Semmelweis never lived long enough to see it. Thank you for watching, and as always, follow us for more facts.